Hello everyone, I'm in Sherman Oaks this afternoon at Art Dentistry. This is Ruzan Hirasawa.
Hello.
And I've been friends with Ruzan for the past, 15 years now?
Mm-hmm.
And I've been nice to work in this office a few years back for several years. And Dr. Hirasawa is experienced for many, many years in different specialties, and he's actually my dentist. And she's my hygienist. She's been working on me, and we've been friends. I'm going to introduce you to you. Thank you for taking time.
Thank you for being here.
Tell me, when does it actually, I know you worked in this office a while back. When did you decide to go to hygiene school?
Well, it's a funny story actually. I started working in the dental field as a dental assistant. I had no experience. I really didn't know what dentistry was about. So I was just young, thinking about what career choices to take on, and I just fell in love with being close to patients, educating them, taking care of their oral health. And I worked as a dental assistant for a year or so, and I think there's something more for me out there to do, so I decided to go to hygiene school. And I had Nellie as a really great mentor at the time.
I was going to say,
when she worked. No, you were here, and you really, she kind of took me under her wing, and she was a good, you pushed me towards that direction, and that's where I am today.
I'm so very proud of you. There's so many dental offices that are out there. What sets this office apart? I can do my take on it. I think the patient care and the quality of service that goes into their work, and she's the hygienist and the husband's the doctor, the dentist, and for years I've trusted my own dental health to them and my husband and family. So needless to say, your patient care is top notch, and the quality and the detail you take part in is unsurpassable. So now your take. Well, how do you think your office sets apart? Why is it so different in your?
Our office is different because, my husband loves what he does. He's really passionate. He's been in the same location for over 20 years. He graduated UCLA and settled here in Sherman Oaks. He just is really passionate. He goes to a lot of continuing education courses. We as a staff go together, which is nice. So we're always trying to keep our minds fresh and see what new research is out there. Even for, some people think dentistry is a small field, but you'd be amazed at how many new, technologies come out. Every year you'll go to seminars and conventions, and you'll see lasers and different instruments, you name it, or different research on different protocols on how to help your patients with certain things. So we're really advanced in that. Our staff is amazing. They've all been here for many, many years. We're almost like a small family here, and we, that translates into how we treat our patients.
Dr. Hirasawa's one of the specialties he has is his cosmetic dentist, and the amount of difference he makes for people, amount of personalities change. They start smiling. The makeovers are crazy. I was part of that. I used to see the befores and afters. It was amazing, and I miss those trips with the continuing.
Those are fun, right?
Texas one, the
Miami
one.
We go all over. We go to Vegas. We go to Cancun sometimes. We try to make it fun for the staff and also a learning experience.
When you're here, you feel the warmth between the employees, and that's huge. Tell me a little bit about the gadgetry that Dr. Hirasawa is so popular with. He's state-of-the-art toys he has here.
Well, sometimes it's hard to keep up with all the new toys that come out in dentistry. It's almost like when we used to have a handheld phone to a tablet, like a little small computer in your hand. We have a CT scanner here, which is great because you get a full comprehensive look of the patient's mouth as opposed to a single film x-ray, which there's no dimension to it. This way with the scanner, not only do you see the teeth, you see the gums, you see the tissue, the bone.
Yeah.
And what's great is you also see the patient's sinuses. So a lot of patients don't realize they have a sinus infection or they have something's going on. So it's a good teaching tool for them too, to see their upper and lower jaw on the screen in real time, and it just pops right up. So that's a great tool for us and for the patients also.
Plus, he does really great implants. Very complicated implant that he fixed for me, which I'm grateful for. So, you know, the scanner, having it there available, convenient, it's amazing. What is this gadget? I'm curious about this. I don't remember this one.
This is a laser scanner. Whoever's been to the dentist before has always had one or two experiences with having that goopy filling in a tray that they take molds with. So instead of putting any goopy material in a tray and putting it in your mouth as a mold,
impressions.
Yeah, to take impressions. With this machine, what they can actually do is they scan the area. So they'll scan the area that they're working on. They'll scan the opposing arch also, so the computer has an image of what your bite is looking like, and that will be sent to the lab. They email it automatically.
Wow, so all the guesswork is taken out of
it cuts your procedure in half. It's more accurate. A lot of things are made with laser cutters now, so any crowns, inlays, bridges, implant crowns you may have now, the fit is just more precise that way.
That's fantastic. A long way dentistry has come, as I see, right? No more of the old supplies. Well, if you haven't been to a dentist for a long time, I want my hygienist, my friend, to tell you what's the downside of avoiding dentistry. I know there's a lot of people who fear, or they've gone through some changes, or they just haven't had time to deal with their dentistry. What's the negative thing about waiting and not coming to the dentist? What could possibly be a concern?
There's a lot of concerns about neglecting your teeth, mainly because anything that happens in your mouth affects your other systems in your body. Patients don't really understand that, and that's another reason why when they come in, we educate them about how their mouth is connected to the rest of their bodies. Patients have underlying conditions like diabetes is a very common condition, which is heart disease, hypertension, and all that really affects wound healing. So if you neglect your gums and your gums are bleeding when you brush, people think that's, oh, my gums just bleed when I brush, that's an okay thing, but it's if you had bleeding anywhere else on your skin or your scalp or something, that would cause concern. So it's really just educating the patient, really taking care of their mouth. A lot of bacteria can also be passed from mother to child. Bacteria that causes certain cavities can also be passed from mother to child, or even sharing utensils. So it's a lot of education, and it's just a lot of taking care of yourself first. Coming in, the ADA says come in every 6 months to get your teeth cleaned.
Even more often.
Some people need to come in even more often. So it's just getting your foot in the door, and once you do, you kind of have a different outlook on how to take care of your own personal hygiene, which is very important.
Well, thank you so much for taking time. Thank you. If you haven't been in for a while, and don't hesitate. Now you've got to meet the expert hygienist on staff, and high marks, flying colors on my end from Dorothy.
Thank you.
So thank you.
Thank you.
We'll see you soon.
Bye bye.